You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. This is a special edition. According to my first guest, no more dentures. Nobody should be wearing a loose-fitting denture. With us, we have one of the few board-certified implant dentists in all of Florida. And we've had him on the program before. He is definitely the go-to implant dentist in all of Florida when you want a brand new set of teeth in just one day. With us, we have Dr. Art Molzan. Dr. Molzan, welcome to the program. Welcome back.
Well, thank you, Randy. I'm happy you invited me back for our fourth or fifth visit.
I know. So I was asking you in the green room, I said, so what's really changed in 8 years when it comes to implant dentistry?
I think the implant technique has just dramatically improved. It's faster, fewer visits. That's the number one thing that patients want. They don't want to know the process. They just want the end product. They want teeth that look good, feel good, last a long time. That's what people want. And we now can do that even better than we could 20 years ago when we started doing teeth in a day, teeth in an hour, and things, the multiple names that they've come up with. We're just better, we're faster, it's a better service to the patient, and with a lot less discomfort and more fun for them. Sooner.
Okay, good. Now you're one of the guys, because you've been doing implants, you said, for about 20 plus years.
Yeah, I don't want to acknowledge that. That's a bad thing, but yes.
And as far as, you said less than 1% of all dentists in the country are board certified as implant dentists.
Correct.
Is that right?
Yes, in order to become board certified in implant dentistry, you have to take an exam and you have to have some knowledge behind you before you take the exam. And so there's only so many of us. I believe it's less than 1% of the dentists in this country are board certified in implant dentistry.
And it doesn't cost more to go to a guy like you, right, that's board certified?
No, and the simple answer to that is no. And the reason behind it is because you have one clinician doing the work. So it's not where 90% of dentistry today is done, where one clinician does the implant part, one clinician does the teeth part. And with an implant specialist, one person's going to do the whole thing.
Does it all right there.
Does it all right there. But that doesn't mean we don't work with other clinicians. I work with about a dozen practitioners in town where I do the surgery. And then there's 2 practitioners in our community where I help them with the teeth. So, but in our practice, everything is done by me.
Okay, good. Now, I was trying to, we were almost arguing in the green room where I'm saying, really, one day? And you're saying, yeah, actually one day. Okay. That means literally somebody watching this, maybe they're going to want to do this in 2 appointments, but if it all works out, they could go in with no teeth in the morning, first time you met them, and if they want to wait around, that by the end of that day, they can leave. You have the technology or the capability to do it that day.
Correct.
Is that right?
Yes.
Okay.
It seems unbelievable.
But typically you do it in 2 visits, though. You want to do it in like 2 or 3 visits.
Most of the time, a patient will come in, we'll have a conversation, we'll listen to what they want.
Okay.
Normally, it's they want teeth in their mouth that look good, feel good, last a long time. That's what they want. The teeth that don't come out. They don't want a denture. So with that, we've devised technology and techniques where we can have the conversation, and if they choose to move ahead, it can happen that day or the following morning.
What if you have bad gums? Like you have the bleeding gums, bad gums, periodontal disease, you're losing your teeth, you have to have extractions. That must take a lot longer. Or no?
No.
Okay.
Those are the people that we see. We see everyone who has bad teeth, bad gums, a variety of different concerns, no bone, little bone, lots of bone. And we've been able to treat every one of those with the same technique with slight modifications. The patients that we work with at a majority of the time are patients who have given up on their teeth for a variety of reasons. They may have had crowns, they may have had fillings, they may have had root canals, they're missing some teeth, or they're missing all their teeth. Dentures are working, dentures are not working. So those are the folks we see, and they just don't know what to do or where to go.
Okay.
And that's part of why we come out and have the opportunity to chat with you, is to have a chance to share with them that there is an answer out there. There's an answer for solid, healthy teeth that can be accomplished literally in 1 visit.
What do they like more? Do they like the chewing part of it? Like when they get their new teeth, do they like all the stuff they could eat, or do they like the way it looks?
It all starts with, most of the patients will say, I just really want to chew. And then once they've got their teeth in there, all of a sudden, and they're able to chew, then it's what's next. And what's next is, well, I'd like them a little whiter. I'd like them a little bit this way or that way.
Okay.
So I think function is one of the driving forces, but aesthetics is so important.
So they start getting compliments, and now they're smiling all over town.
Absolutely. And I mean, the smile is a gateway to the soul, in that as these people smile, I mean, folks spend a fortune getting haircuts, getting suits, and women doing all the things that they do. And it's amazing how one set of beautiful teeth will make all those other things just look so much better. In fact,
that's a good way to put it. Yeah.
We have a plastic surgeon that we work with occasionally, and he always recommends, go get your teeth fixed first, and then I'll fit the face to the teeth.
Yeah, we're seeing that more and more. You know, I've had plastic surgeons on the show, Drew Orden from the show The Doctors. And one of the things he was saying, he goes, Randy, the teeth you can't have old teeth and a young face.
No.
It's interesting that
and vice versa.
Yeah, you got young teeth and an old face.
Yeah.
So it goes together.
Yeah.
Now, look, you've done more than, I mean, you do more implants, let's say in a week or a month than most guys do in a year.
Correct.
Right?
Yes.
And I asked you this a little while ago. You know, of course, after you've done more than 5,000 of these full arched, brand new sets of teeth, is there a huge learning curve?
Yes. Yes.
Are you that much better, than you were even 1,000 of these ago?
Yes. Yes. I mean, we're on a continual education process on trying to figure out the best way to bring the service to the patients. And so, yeah, I'm so much better. And that's one of the things I see with a lot of the new clinicians trying to get into the game, because this is a wonderful service for people.
I've asked you about what's changed. You know, you've been doing this more than 20 years with implant dentistry. But what have you wrapped your mind around as far as, because you've said it when I first met you, said, Randy, it is life-changing. Can you talk to a patient nowadays? They come in, they're upset, they've got a hard luck story. Do you get excited thinking they have no idea how good this is going to be? Absolutely.
No, it's a life-changing experience for the majority of the people.
When you say life-changing, what do you mean?
Well, it just takes them from a situation where they, one, are unhappy with their smile and their teeth. They're concerned about their health. And we can switch that all around in a single visit and give them a beautiful looking smile that is healthy, infection-free, and they just can't believe it. And that's many of the, I have patients coming in all the time who have watched this program, and they go, I've watched it 5 or 10 times, and I just can't believe what you say is true. It just can't be true.
So they come in skeptical still?
Oh, absolutely skeptical. The vast majority are still skeptical. They can't believe that it's possible.
Is that right?
Yeah. And so that's one of the reasons we have a free consultation, to try to break down the barriers to get them into the office to find out, because they really don't know where to go.
I mean, you say they wait too long to get this done. Elaborate on what you mean by that.
Well, many times they have observed this interview and they've been thinking about it, and they may have talked to a patient, a friend who has had it done, and they're just unsure. They don't want to make a mistake.
Okay.
That's they just don't want to make a mistake and have it not be what they think it is. And so what they do is they lose years. Many of these people 10 years ago, they knew this is what they should be looking at as an option, and they haven't done it, and they've lost 10 years of their life.
So 60 to 70, they could eat or chew.
Or 50 to 60. They're not smiling and they're not chewing. The two big things.
Do they say that? I mean, do you ever hear that? I should have done this years ago. I kicked myself for not doing it earlier.
I've got a few photos that we'll go through later, and I would say 50% of the people in those photographs say that exact same thing. I wish I'd have known. I wish I'd have stepped forward and got going sooner, because I love it.
Okay, good. Let's take a look at what you got.
All right. I'll give you Ed. Ed's one of our favorite patients, a wonderful guy. He had some teeth that were bad, let's call it that way, and again, didn't know where to go. dislike of the dentist, as I think 99% of the world has.
Yeah.
And in Ed's case, his option was a denture. He didn't want a denture. That would ruin his life. And so we were able to do teeth in a day, and those are the teeth that we finished up with. And the fun part for Ed was we waited, I think it was about 6 or 8 months, and then we went down and did the lowers. He was so happy with the tops.
So that's not his lowers yet?
Yet. They were the lowers we did later on.
And these people, like, you could eat ribs or you could eat nuts.
The final teeth.
Like chewy things.
Yeah,
Really?
the final teeth, there are no restrictions.
The patients ask that a lot, like, Doc, are you sure?
Yeah.
Or how soon could I eat something?
Everyone has something. A peanut,
Okay.
an almond, a steak, a carrot.
Okay.
They all have one item. They go, will I be able to eat that? I always ate a salad. Yeah, they all have something that they really desire to have, because what we do is we help them get back to normal function. That's the bottom line on the whole process. Getting them there quickly and efficiently in one visit is the miracle of this all on 4, all on X, all on.
When you call it those terms, that means that, like, 4 implants and then a full arch of teeth that go on top.
Correct.
And they're locked in solid.
Right.
Okay.
And don't come out. Because that's what people want. They want teeth that don't come out, that work and function like normal teeth.
And the prices are coming down.
Yes.
From the day I met you. I mean, it's going down and down and down, because everything's what, computerized?
Yes. And even with, this is a move from the technology of the past, where we always did bone buildup, bone grafting, and then would put 12 implants in, and it would take a year or 2 years to get done. Our fees were astronomical because of the service required so many surgeries, so many visits, so many to get you done. And now that we've moved into the teeth in a day, all on 4, all on X, there's multiple names for the service, but the service is based on a 1-visit procedure where we can remove bad teeth if they're there, clean the infection out, drop the implants in, and fix teeth to them the very same day. So that has been the biggest cost driver down, because there's not that much time in the dental office.
Yeah, look, Medicare doesn't cover this. Medicaid, even great insurance doesn't cover it, only a small portion.
Correct.
You say people are financing this.
I would say.
Is it common or rare?
I would say almost every patient will be involved with some form of financing.
Okay.
And I mean, everyone, because our country, our mentality is such that we can work a payment into our system. It just can't be a real big payment. And now with financing that can extend out for a very long time, we have very,
But
very
you're not
reasonable.
carrying the loan, so they have to have okay credit.
They have to
basically.
have some okay credit, because they're working with companies, but the companies are out there now.
But with enough down payment,
They can.
usually there's something they can do.
I'd say the vast majority find a way to make it happen.
So no more dentures?
No more
do you
dentures.
think you'll see it where the days of dentures are just over? They'll always be attached to something?
I'd like to think so. The world's moving in that direction, and I know that, let's say in Sweden, it's much more common than here. If you look at the percentages of dentures in Sweden, it's a very small percentage, because they have government
So
sponsorship.
it's their standard of care over there?
It's their standard of care.
Okay,
Yes.
interesting. More photos.
More photos. Let me give you Bernie, one of my favorite patients. Bernie, a highly successful businessman. Teeth did not represent that. He lost his teeth, lost one tooth when he was, I believe, 5 or 6 years old, and then later on in high school lost the other 3 front teeth. Never had a smile that he liked. He's got a beautiful wife, a great business, and he just doesn't project that way. Was very nervous, didn't know what was possible. So in Bernie's case, this became a truly life-changing experience. And Bernie, to replace those missing teeth, had a partial. Partial was put in cockeyed, the lower teeth moved around to the wrong spot. Just couldn't function, couldn't chew, couldn't bite anything. And he's a super successful guy. He was super successful with a poor smile. He's going to be even more successful with a new smile. We have a gal here, partial. And partials, as we know, will tend to break the teeth that they're hooked to, because the teeth are getting too much stress. And so where do you go and what do you do? Well, in this gal's case, we were able to do the upper for her and blend it to her bottom teeth. So she only needed one area fixed. And that's one of the nice things, because a lot of our patients, maybe due to budget or other concerns, they want to have the top done first.
Okay.
And so we'll do the top, and then we'll blend it to the bottom so everything is a little bit nicer, a little bit lighter, a little bit better looking, but we may leave those bottoms in. I have one patient, Frankie, where I did her upper 10 years ago, and we just finished her bottoms this summer. And in the meantime, I got to work on her husband and fix his upper and lower, and her daughter's upper and lower. But due to budgetary constraints, we stretched that whole thing out, and she's now completed over a 10-year period of time.
As long as you brush them and take care of them, I mean, they're supposed to be permanent in a way. I mean, they could last as long as you do.
Correct. As long as you care for them, they're designed to last your lifetime. That's the goal. And our practice is one that has a hygiene department and does other services of dentistry, so that we're there to take care of you. Our goal is to get you through life with those teeth. So we're in it for the long term. We're not just going to do the surgery and then send you off.
Are you one of the most experienced guys in Florida? Are you allowed to say that?
I think I am, just due to age. We've been in the game now for, I'm not even going to say how long. It's going to make me look old.
But you've been doing it more than 20 years for sure, in just implants.
Yes. Yeah. We've been at it for a very, very long time, and have I believe probably have done more implants than anyone in the state of Florida.
That makes you the king of dental implants then in Florida.
Well, some would argue that.
Okay, good. So you have more photos.
All right, let me give you another one. This is Rhonda, one of my favorites, and this relates to the story that not all dentists are the same. I think all dentists are very good people as a group. I think we're some of the best people in the world, but I also think that there's a big learning curve, or a big diversion between education once you get out of school. Because implant dentistry, you learn after school. You don't really learn it in dental college. So you have to learn it after the fact. So in Rhonda's case, she had gone to 5 dentists before coming to talk to us. 5 dentists told her her only option was a denture, top and bottom.
Okay.
And she had really bad teeth, and the bleeding gums and all the infections and things. And so she said, I can't do that. That's going to ruin my life. That's not who I am. I'm not going to put my teeth in a cup of water at night. That's not.
So that's why she comes to you.
Yeah. So I was number 6, and if I hadn't given a good answer, she would have been on to dentist number 7.
So it's a training difference, actually.
Oh, I think so.
Like 98 out of 100 dentists don't do dental implants.
Correct.
Okay.
At this point, yeah.
All right.
More coming into it, but in a sense, that's a little bit of a problem, because I don't want to be your first implant candidate.
Yeah.
You know, if I'm having it done, I'd like to have
the experience.
I'd like to have someone who's got a lot of experience behind them. They have to have done a bunch. So Randy, if you look at the before, the front tooth actually wiggled when she talked. It was so weak. And so then we're going to flip over, and if you look at the after, if you look at that smile that goes across, that smile is there by design. It was engineered for her. That picture was taken 2 weeks after we did the procedure. 2 weeks. She comes in with new hairdo, makeup, fancy dress.
She looks better.
She walked through the hallway. I didn't even know it was her. I didn't know it was her. And the look, and if you can go back between the two, the eyes on the before and the eyes on the after tell the whole story. It's a different person.
Nice.
That is the answer for her. That's the beauty of this procedure, is just giving people what they want and doing it in a single visit. And one last thing to point out is, at this point, that's at 2 weeks. And her smile is just now beginning. She's used to not smiling. She's used to not smiling. And so over the next 6 months, she's going to get a beautiful smile back.
Like a bigger opening of the mouth.
A bigger smile. She's going to learn that she doesn't have to be afraid to smile.
That's fair.
Yeah. So, no, it's just a wonderful thing.
Do they ever want to give you a hug, like some of the?
Oh yeah. But when we're done, it is a life-changing experience for most of those patients. It's a total delight to work with them. Let me give you Susan's picture.
All right.
Petrified of the dentist. Sedation was the key to helping her through the process, and telling her that we could do it in one visit with sedation is what got her to do it.
She's in.
She's in, and was still so afraid to come into the office and get started that first day. It was unbelievable. Now, in her case, she sang through the entire procedure. She was so happy being sedated. It made it a little bit difficult to get my fingers in and out of there, but she sang through the entire procedure. And so we got her top fixed, we got her bottom fixed, and
so she would have been wearing a denture.
oh, absolutely, and would have hated
Now,
it.
in that photo, the before photo, is that her? Like she can't even show her upper teeth?
Well, yeah, I'm not sure whether it's a physical thing or a mental thing, because she's afraid.
To show her teeth.
She's afraid to show her teeth because they don't look good. And now, just a short
That's
while
a
later,
pretty smile.
a short while later, just a totally different face. The faces just tell the story, and we're only fixing the teeth, so that's a good thing. Yeah, no, she was a wonderful patient, and now she's on cleaning once a year.
So when they look in the mirror and see their, like this is dramatic to me. When they see their face for the first time, do they get choked up? Because I know they're a little still sedated, right? But when they see it,
Yeah.
do the tears come? Do the
Yep.
spouse, let's say if they walk in?
Yep. But again, them being sedated, it's like, whoa, that looks good.
Yeah.
So yeah, but they can't believe it.
Okay.
They still can't believe it. That's why they're afraid to make that decision. They're afraid to make the wrong decision. They still have that in their mind until they turn around and see it on the big mirror and go, yeah.
So somebody watching this right now, day after tomorrow, they have no teeth. They're watching this without teeth. The day after tomorrow, they could have upper and lower teeth that don't come out.
Correct.
That's true.
Yes.
It's possible.
Yes.
Of course, if you have an opening in your schedule.
Yes.
Course.
Well, we have to work that.
But wow.
And here's an example of that. Phil, I like to call him Phil the Greek.
Okay.
Phil the Greek came in, had not worn any teeth, for 20 years. His daughter pushed him in. He wanted to take his family on a Mediterranean cruise and end up in Greece and show them where he came from. Okay. So he went from 20 years of no teeth to teeth in one day. And
those are upper and lower teeth don't come out.
They don't come out. And so we gave him a Sam Elliott smile. I think he looks just like Sam now. It's a different guy.
So look, 20 years with no teeth, obviously eating food without teeth. For this guy, this is like a big deal.
Yeah.
Right? I mean, he can't help but say, I should have done this a long time ago.
Oh, yeah. Yeah, absolutely.
Well, people don't like the dentist.
No.
Nobody wants to go to the dentist.
And no one wants to take that step. Someone has to push him. And in his case, it was his daughter. His daughter motivated him. She was there for him, encouraged him to go forward, and now he's the happiest guy in the world. He thinks he's Sam Elliott.
Okay, good. Now, I'm going to rush you because I know you wanted to show these photos, so I'll kind of push you through these.
All right. Here's an example of someone, wonderful, wonderful gal, has some problems with her teeth. The problems underneath are worse than the way they project. So she knew she needed something done and didn't know what to do. The issue there is, if you look at the before picture, is the gum line presents itself where even if I fixed those teeth or worked around those teeth or capped those teeth, the smile wasn't going to be a nice smile because of where the gum was positioned and how high her lip went up. So teeth in the day is the only way that you could fix her and give her a beautiful smile.
So again, she would have been in a denture.
Yeah.
And now she has these new teeth. It's very nice.
Yeah.
Good photo.
Yeah. I mean, just she's an example of having a lot of tools in your tool bag so that you can take your tools and help these people no matter where they're at. Whether they've got no bone,
Meaning
little bone.
your training,
Yeah,
you can
the training.
laser the gums or take care of the gums.
Having the experience to be able to do the whole package for them. Whereas most people, they might be able to do the simple ones, the easy ones. But we have enough experience over these thousands of people we've been able to help that we can fix anybody.
So you haven't really met anybody you have to say, hey, there's nothing we can do.
We haven't.
Very good. That's why it's worth a consultation. Let's jam through the couple more photos, and then we have to wrap up in less than 2 minutes. Here we go.
And then we have a gal who had very nominal bone and only a few bottom teeth, By fixing top and bottom for her, we were able to change her smile, change the color, and most of us would prefer to have a little bit whiter tooth if we could do it. So in her case, not only did we give her a healthy smile that she could chew and function normal, again, normal is the emphasis, but we also gave her a pretty smile. She's a
gorgeous, looks good.
She's a happy girl in the first picture. She's a happy girl in the second picture. She just has a prettier smile.
Now, I know this is one of the things you want to talk about on the show, that the new guys, the new dentists that are learning implant dentistry, they usually start with the snap in, snap out style. You're not a fan of snap in, snap out?
Unfortunately, I think that I just think that's old technology. And that's something I was doing 30 plus years ago. And the reason it's done is because it's easy. The concern I have is you still end up with a denture that goes in a glass at night. And people don't want that.
Okay.
You know, I mean, they might chew better with a couple snaps and this and that. I understand that.
You say there's a lot of maintenance too?
Oh yeah, there's that. Anything that goes in and out has to have something that it clips to or locks onto, and those pieces wear out. So there's every 1 to 3 years you're going to be back at the dentist, spending some money and spending some time figuring out what needs to be replaced so you can continue to keep those teeth from moving around.
So go for the option of getting fixed teeth that don't come in and out.
I think that's the newer
way to go. A little bit more money, but
it's a bigger investment, but you get more for it. You end up with teeth that feel like your teeth.
Okay, good. Final message. We are out of time. Somebody watching this, there are the two categories. The people with the bleeding gums, bad breath, loose teeth, that they're going to lose their teeth.
Yes.
They don't know what their options are. And then the denture wearers. They're watching this.
They are.
What do you say to them? They're still skeptical. They've heard what you had to say.
Well, I think it's come in and talk to us. That's the name of the game. We offer a free consultation. We take a CT picture. We've got the best CT machine in the world. We've got the Atero, where if we need to take a camera impression, we can take an impression with a camera. We have all the latest gizmos and things, and we can tell you in one visit whether it's possible, which we know it is, and number two, what would be involved in doing it, both in time and cost and the things that people are concerned about. And that's what I'd suggest. I mean, take the first step, because for like in so many things, most of our patients don't care how much you know until they know how much you care. And we care about doing and providing this service. That's the name of the game. And that's why we offer free consultations. We spend a good portion of every day talking to people about what's possible.
Dr. Molzan, always a pleasure having the show. Thank you so much. If they want to make an appointment, can they do it through the website?
Yep,
call your office, either way.
Randy, thank you so much for inviting me.
Good stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.